Hey Donnie, how you doing, man? My name is Jesse Oliger. I got a big idea. I want to revamp the weight belt industry. So, as you know, kickers and linemen are always good friends, so that's why I'm sending this to you first. In all seriousness, man, I'm a big fan of yours. Been a big fan for a while. All the cars and PTs, they always follow you. So just nice to be sending to you this first. So the problem I want to solve is same as everybody. Anterior pelvic tilt, it's not going away. We're not going to be sitting in perfect chairs anytime soon. So obviously short breathing, the whole story. Anterior pelvic tilt, transverse abdominis turns off, no access to the upper butt, and shit happens with the QL and Psoas. It just goes haywire, especially with the bigger guys. So a little bit about me. I was an NFL kicker, punter. I went to University of Miami, played in the NFL for 3 or 4 years, just bounced around. Never found a permanent home, but I had a great time. But I've been teaching kicking on the side ever since. And long story short, kicking coaches just don't get it. They just refuse to learn, and unfortunately for me, I partially tore my hip flexors, so I lived in pain for a while, and I didn't want a surgery, so I just kept digging and digging, and that's how I found out about all this stuff, and just got better at it. Finding guys like you along the way, Kelly Starrett, who I know you know. I just got better at teaching it, and so it's good to be talking to you about this. So there's a couple applications. I want some QL and Psoas distraction for the weight belt. Everything's thin up front, big in the back. I want big on both sides, and I want kind of like a distraction on the inside, and I'll go over this in a video in a minute. For the backside, little half lacrosse ball shoved underneath your 12th rib, kind of distracts so you can get your breathing right, especially for like a young kid in the weight room before you even begin. So there's 2 applications. One's a weight room application, which you are the man, and the big implications I have besides the weight room is more mobile version. So I'm thinking it's huge. It could be yoga, and it could be Pilates. I teach some Pilates. It's great for my kickers. But for swimmers, proper breath, how many labrum swimmers, tears are there in swimmers? So literally every position, but more something that you could wear mobily, even sit at work underneath your shirt, so no one would even know. But the list goes on and on. But I'm gonna make this video for you. You'll see here in a second, and I would love to get your thoughts. I appreciate your time, Donnie. So here I am at a sporting goods store. Here's weak assortment of weight belts. If you notice, none of them have any inside distraction on them. Some thicker padding, but nothing really distracting the QL or Psoas. All flat. Here's the leather one. So trying on these belts, obviously they got pretty good back support, pretty solid back there, but they're all thin up front. There's absolutely nothing that distracts your QL, transverse abdominis, and even though you have the support here, there's nothing. I think a little distraction would really help get the QL. That'll balance out the hips before the rep begins. Here's a different belt, same thing. Here's a thick old belt, I'm sure you're used to seeing. Same thing, they got a tight belt. Sure, it makes your belly tight, but a lot of the guys, especially with sacrum, S5 issues, there's nothing jamming it right above your pubic bone. So I think a little distraction up here and a QL would make a world of difference in it, especially with the breathing setup when you exhale. So you push your fingers out, brings down the ribs, shoulders down your back. I just think it'd give them a better base before they begin the rep. All right, so my idea is the back side would look a hell of a lot like the front side. So the front side would go here, dip down, kind of right above your pubic bone. Now, I'm just using this because I don't have anything else to mimic it. I'm using some shoulder pads for a lacrosse player. But what I'm gonna do, I'm gonna flip this thing upside down, and these white things, it kind of tracks how the Psoas goes right near the transverse abdominis, and then I just pop this puppy right on here. So for the front side, kind of like a Psoas distraction, I found this, it's just a lacrosse glove, but you can see it's thicker and wider down here, and the padding gets thinner and thinner as you go towards the end of the thumb. Kind of mimic the psoas. So on one side be kind of like a triangle, start wide, work its way up towards your above your belly button, almost at your 12th rib, and then same thing on the other side. So you got lots of protection for your low spine and bottom traverse abdominis right above your pubic bone, and it gets thinner on the way up and protects your spine. So for the back side, I got lacrosse ball, chop this thing in half, practice baseball, just put it right there, and that'll really jam it up all the way underneath the 12th rib. So the idea would be to either have on the top of it where you strap it in, either have Velcro right here, start the strap from here, either a buckle here and a buckle here. You want to pull the strap here through this back buckle. You pull it over and adjust more for tightness, whether it's got a hook or goes. I'm just using this Velcro just to see what that would look like. But if it were right above the QL or underneath the 12th rib, the more force you get in there, the better distraction you have on that QL. Pull the rib cage down, strap it down, then you can just take that deep breath or however you set up with your breathing to kind of activate your lower abs before the rep.